Hi, welcome to the Silicon Health Institute. We are a nonprofit organization where we want to bring leading experts to the world so you can get this information and you can be proactive in your health and take steps so that you have an optimal lifestyle and health. I mean, if you've got normal values, lab values, that doesn't mean too much because it's based on 95% of a very sick population. So we have to do a little more than wait for the doctor to give us a pill for an ill. So we have two folks with us today, both quite expert in the gut. So we're honored to have them. There's Dr. Jose Montoya, and there's Christine Rosche, who's an expert in gut health, et cetera, and nutrition. So let me tell you about Dr. Montoya. He's originally from Barranquilla, Colombia. He's completed his medical school with honors and the Universidad de Valle in Cali, Colombia. He finished his residency in internal medicine at Tulane University in New Orleans. He began his postdoctoral training at Stanford in 1990, where he completed a 4-year intense fellowship in infectious diseases. I think we were there at the same time, under the mentorship of Dr. Jack Remington and Thomas Merrigan. Dr. Montoya had the unique opportunity of having been chosen by Dr. Jack Remington for additional 7 years of extended fellowship on toxoplasmosis and immune responses against intracellular pathogens at the Department of Immunity and Infectious Diseases Palo Alto Medical Foundation. He's considered an international authority in toxoplasmosis and is currently the director of the National Reference Laboratory for Diagnosis and Treatment of Toxoplasmosis, the Dr. Jack S. Remington Laboratory for Specialty Diagnostics. No. The Remington Lab is CLIA certified and the Toxoplasmosis National Reference Laboratory for the FDA, NIH, CDC, and clinicians throughout North America and the world. He joined the Summit Therapeutics as a medical advisor in December 2021, founded the Art and Science Boutique and private medical practice in June 2022, and the Art and Science of Medicine focuses on ailments that do not have a home in the silos of conventional medicine, including chronic unexplained illnesses such as chronic fatigue syndrome, chronic fatigue, long COVID, and menopause. Okay, so, and there's so much more that he's done. He's published over 200 articles, book chapters, et cetera. So he's done a lot for us. Now, Christine Rosche is an M.P.H. and C.N.S. certified nutrition specialist and a microbiome health expert. She's developed an integrative approach to digestive health based on 25 years of experience in the healthcare field. She developed and taught courses to Stanford University Medical Center, is the author of 2 books. The latest is Light Living, an Integrative Approach to Stress Management and Weight. With the companion audio CD program, she studied and worked with the leading functional and preventive medicine physicians in the US and Europe. She's maintained a private practice in medical nutrition, therapy, health counseling since 1983, specializes in customized digestive health nutrition, consulting for all kinds of stress and digestive issues, including constipation, diarrhea, irritable bowel syndrome, inflammatory bowel disease, SIBO, heartburn, absorption issues, gut permeability. As a licensed heart math trainer, she pioneered in the work of heart rate variability, biofeedback for stress, burnout, and gut health. So welcome, Christine, and welcome, Dr. Montoya.
Thank you, Susan. Yes, thank you, Christine, for this idea, and Susan for hosting the event, and those who are attending. We hope to bring you something that can be helpful. And we basically primarily evolve around the axis of inflammation and inflammation related to the gut, and how inflammation and gut abnormalities underline lots of things that today conventional medicine does not have an answer for, or they might say, we don't know what you have, or what you have is psychological, or if they say, well, you have something, we don't know what to do. So we hope that today's presentation may share some clarity in this regard. So let's see here. Yes, so we'll go over the concept of how the human immune system has evolved over hundreds of thousands of years, but more pertinent to the presentation today, over the last few hundred years, to become more hyper-belligerent, angrier, with the potential to cause harm. Why humans are now being left with immune systems that can cause harm, that it was not the case just a few hundred years ago. The immune system is the primary biological connected world that is behind millions of deaths that follow infection. So we tend to think about an infectious agent of bacteria, virus, parasite, fungi, or something that eats the person's cells somehow. But a lot of the damage actually comes from the immune response that is supposed to defend us against that infection. The immune system is also part of why these chronic unexplained illnesses develop following an infection. And there is an increasing recognition of cytokines that are components of the immune system. These are small proteins that allow the communication between one cell of the immune system and another, and between one place of the immune system and another. And also we'll touch on why and what could be the role of herpes viruses connected with this inflammation that seems to be hurting us. I will present to you what I consider a three-partite approach, a three-pillar approach to how to address this inflammation. And very importantly, I have the pleasure to have Christine as a collaborator, the role of the gut microbiome, both in health and disease, and the potential of manipulating in the right direction the gut microbiome. There is a balance and a homeostasis, primarily meaning balance, in advanced immune systems that are surrogates for health. When you see someone healthy in every way, physically, cognitively, emotionally, primarily that is behind that all those highly interconnected organs that require to be there for that health. But another major component of health is a balanced immune system, where you have to go after a task that is very delicate, but at the same time not get harmed in the process of achieving that delicate balance. There is a very good idea now, and achieved over the last 50, 60 years, that the immune system can fail humans either because it's deficient, but also because it's overworking. So it's very clear that we can have immune diseases from deficiency. So we have the patients who have cancer or transplant or AIDS, but also an overworking immune system can lead to allergies, clearly to autoimmune diseases, or simply a dysregulated immune system can lead to disease. So it's not only that it fails us from being weak, but also we can be harmed from being too strong. And the new paradigm is that there are situations where the same individual, the same person, can have both, can have a component that is deficient, that allows infectious agents to come in more readily, but also there can be another component in the same person of the immune system that is overreacting to a trigger, to either an allergen or to an infectious agent. So that is something that has taken a while to cut up, but is clearly the case in many of the things that we see, that both things can be present in the same person. So the immune system was place in vertebrates and evolved to humans to defend us. This is a beautiful picture of a macrophage, which is a cell of the immune system, eating an infection called Mycobacterium tuberculosis, an ancient killer that was there to help us. However, as I mentioned earlier, a hyper-belligerent, the same immune system supposed to defend us can fail us and can cause death. And most of the deaths that came from the recent pandemic that started in December of 2019 that led to more millions of deaths worldwide, most of that deaths were because the immune system in the second week or the third week after the infection. And also can be the reason why people have an infection and they are followed by an unexplained illness that can devastate their lives for decades. And there is also very good data that as humans live longer, it's not unusual to hear people living 90, 100, in Japan, 110, 117, yet you see seniors at these levels of age, some of them living relatively healthy and others living in highly frailty states. And there are really good data that those enjoying good health have their inflammation under control or in balance, and in contrast, those with highly frailty states in advanced ages is because they have inflammation that is out of control. So lots of things that the immune system help us with, but also we are paying a price. Part of the reasons of why we are being left with immune systems in humans in today's world that is stronger has to do with the fact that over hundreds of years, we were able to prevent the deaths and treat infectious diseases. It's kind of like the survivor downside. So back in the 1800s, it was not infrequent that humans will live up to the age of 40 or 50 because they will be dying of tuberculosis, malaria. But as the world conquered that through hygiene and through understanding that there was an infectious agent, that understanding that an infectious agent, a foreign agent, was able to cause disease or infection only came clear in the late 1800s. As that became that there was a way to prevent it, what happens is that those who got infected but survived was due to genetic better immune systems. And those genes were passed to the subsequent generations. So over time, we have been creating, or we have been left with humans who have a stronger immune systems because of the survival of these infectious agents. The other possible contributor to stronger immune systems over time is the hygiene hypothesis, as we are exposed much less to soil, where there are bacteria that help to shape our immune system and train our immune system to be more elastic, more flexible. And parasites, actually, there are really good data that actual parasites that are in the gut help to make the immune system more plastic. And obviously, in the developed world, that is a word, there is a lot of very little exposure to soil or parasites. And there are really good data of kids where there was no soil exposure having way more asthma and allergies than the opposite. Same with pet exposure. And the microbiome hypothesis where the dysbiosis from the lower interaction, for example, with pets, also have made the immune systems more stubborn, more rigid than if you were to do the opposite. This is a beautiful example of exactly what I just presented. This is a population in Sardinia, southern Italy. And here in the vertical axis on the left, you have the incidence, like new cases of an illness. In this case, on the left is the level of malaria. So there was a lot of malaria back in those days, lots of malaria. And as malaria was conquered, the levels of malaria went down in this population, the levels of autoimmune diseases, manifestation of a stronger immune system, increased dramatically, including multiple sclerosis and what is called systemic lupus erythematosus. Is a B cells going crazy and attacking your own body. And there was a B cell activating factor level that, as the malaria went down, increased, and after the malaria was further down, further increased and correlated with the presence of these autoimmune illnesses or manifestations of the hyperimmune system. This is a beautiful data from Iran over a period of 27 years, where the new cases of multiple sclerosis and the cases of multiple sclerosis increased dramatically over that almost 3-decade period. And so did deaths from MS and also disability from MS. And that's from Iran. And when you look at the whole world, same idea. And if you divided it between, developed countries on the left and developing countries on the right, and you look at multiple sclerosis down here, there has been a steady increase of cases of multiple sclerosis. That is, these increases are significant in the developed and in the developing world. And the same way with another entity, meningitis, that yes, it involves an infection, but it involves an inflammation that is significant to the brain. And the immune system is this highly interconnected system that basically needs to have lots of feedback loops, negative and positive, to produce health. And it all comes from that self-renew, called stem cells, that are located primarily in areas of like the long bones, like the femur, like the sternum, and in other flat bones like the iliac crest in your pelvis. And in those places, these cells are there. They have their own capacity to self-renew, and they are the ones that give birth to the cells of the immune system. And they have but primarily one major self-renewing mother cell, if you will, mother stem cell, and they give to what is called myeloid progenitor, and that gives rise to a whole set of type of cells on this side, on the left side, that we call them innate immunity. And those are the cells that respond fast to when anything happens, infectious or allergen. And they are like neutrophils, eosinophils, mast cells. They react fast. And then the same stem mother cell give rise to another type of cell called lymphoid progenitor. And they tend to produce cells that are more, they come later, but they come more targeting the pathogen. And those are where the T cells are located and the B cells are located. And B cells are producing antibodies, and T cells are producing cells that kills infected cells. So it's a highly complex, highly interconnected world. And there are new discoveries. For example, we used to say all the lymphocytes are innate immunity, meaning they respond fast. And now we know that there are lymphoid cells that are part of the immune system, of the innate immune system, and that they can be more shared between the two worlds. Also, over the past 10, 15 years, there is an increasing recognition of cytokines, like an army of little proteins that the immune system uses to communicate from one cell to the other cell. So like macrophages here on this side of the innate immunity, fast responders will produce something called like interleukin-1 or interleukin-12. And that interleukin-1 or interleukin-12 will travel where the T cells are, for example, the cytotoxic T cells that are also CD8 positive T cells, for those cells to produce another cytokine, interferon, that will fight viruses. So these cytokines have been recognized as a major, not only connectors between different components of the immune system, but also that have the capacity either to help us by decreasing inflammation or to harm us by increasing inflammation. One note is that we in medicine have been so arrogant that we have considered two measures of inflammation, the erythrosedimentation rate and the C-reactive protein, as the markers that will decide someone is inflamed or not. And that's far from what it really happens in the body. The erythrosedimentation rate simply measures how fast the red blood cells go down to the bottom in an upright tube. That's it. How fast your red blood cells go down in a tube. And the C-reactive protein basically is a reflection of interleukin-6. That's it, period. So, and we have been so stubborn and arrogant that we tell patients, you don't have inflammation, you don't have any issues related to your immune system because your sedimentation rate or your C-reactive protein are normal. When there is a whole world here that is happening and that is producing inflammation that does not affect ESR or CRP. So just to give you an idea of how complex this world is, I will show you just one slide about a mast cell that many of the patients who suffer these long illnesses, long-lasting illnesses that are declared as fully understood, but I will say today that we are in a far better place than we were 10, 15 years ago in trying to understand these long-term illnesses. This is what I will show you is a highly simplified overview of a mast cell. And it's a highly simplified overview of the things that these cells produce or secrete and that these things affect. This is just a simplified overview of a mast cell. So you can see how just doing two things, sedimentation rate or will miss all of this that you will not be able to capture through this. This is a good depiction, a good graph of why patients in the COVID-19 pandemic die. So patients will either be, as is well known, asymptomatic and have the virus and nothing will happen. Some of patients will have mild illnesses. Others will have more moderate illness where there will be symptoms like cough and symptoms of pneumonia. Then there will be those with severe when the oxygenation starts to go below 94%. And those with critical illness that go into the intensive care unit. So usually in the first week is when the virus is replicating. Some of the immune system is trying to address that. That's the time where antivirals have their best role. But 2 to 3 weeks later is where you saw these millions of people succumbing to the infection because primarily inflammation and the coagulation system being hyperactivated. And the spike protein of this virus has something that evolutionary had not seen before. It went after a receptor in human cells in their lungs, the so-called ACE2 receptor, the angiotensin converting enzyme 2 receptor. And that receptor was placed in evolution as a guard, as a checkpoint to keep inflammation under control and coagulation under control. And when this spike protein from this virus messed up with that receptor, then it led to this unleashing inflammation and coagulation that led to so many people dying. So most of the deaths, I will argue, that came from this pandemic were due to an overdrive of the immune system. And in fact, a lot of the efforts when patients are so sick is to decrease their inflammation. And one of the few drugs that have been found to impact mortality, to decrease deaths from this is dexamethasone, that is an immunomodulator, proving for the proof of concept that that's the case. A lot of patients, after they have the acute infection, going to have this long-term illness, and they have so many symptoms that can make the patient's life impossible. and make it physicians to not have a good understanding of why they seem to be disconnected, the symptoms, in other words, and it's not indistinguishable. It's very similar to we have seen in so-called chronic fatigue syndrome for decades. So the world just witnessed in 2 years or 3 years now, the world just witnessed in 3 years what patients with so-called CFS or ME, and I would like to please not get into semantics in this conversation, what patients with long illnesses following an infection have been telling the world for decades, and the same is suffering what is called chronic Lyme disease. So there is a really good editorial by Dr. Tony Komarov, who has been a witness of all these decades of how these patients have suffered and have documented how knowledge has evolved, where he says that long COVID and chronic fatigue syndrome share not only the same symptoms, but also same underlying biological abnormalities. And that leads to patients going to many specialists for years, and each specialist will give their own view, depending on what the specialist is familiar with. Then they will give that input, that diagnosis, or that treatment to the patient. When in fact, one can reduce all those apparently disconnected symptoms to at least 5. And I would love that you can mention this to your primary care providers, that if there is at least something that interferes with the ability of the patient perform tasks at the physical level, the fatigue that never goes away with rest. And this is not the fatigue that you get when you do more than you should. This is a fatigue that is present even before you start to do anything. That's a different fatigue, and it's very unfortunate that we don't have a better word for that. And then post-exertional malaise, getting way sicker after you do more than your energy allows it, and the unrefreshing sleep, wake up and already tired, and the so-called brain fog and the orthostatic intolerance. It's very hard for me to find a patient that at least does not have those first 3, and they may have the brain fog or the orthostatic intolerance. And then there are many more symptoms after that. But at least if one focuses in these 5, it's easier to approach this patient. There is no question that chronic fatigue syndrome or myalgic encephalomyelitis or now long COVID or chronic Lyme disease, there is no question these are real entities. And conventional medicine has failed these patients over decades. And it's something that is costing society billions of dollars annually. And what I think happens is that there are a lot of potential insiders. You could develop a protective immune response to any of these infections, viral infections, bacterial infections, fungal infections, parasitic infections, and now the recent 2019 new pathogen in humans. And it's supposed to protect you, but there is something that in some individuals lead that protection to become harmful. And I am tempted to believe that it's because our immune system over the last 200 years had become angrier for the reasons that I invoked a few minutes ago. And so something leads to this perpetuation of the immune response that does not get turned off, and that we don't know what it is. We do not know why the switch doesn't turn off to the previous balance. And I will argue that a contributor to perpetuating this is reactivation of intracellular pathogens like herpes viruses, or maybe an unknown pathogen that it has not been discovered yet. This is work that I did and published in the Proceedings of the National Academy of Sciences. And we found that if you see the x-axis here, you have on the first item is controls, then patients with CFS with mild, moderate, and severe disease, that's what the x-axis is. And in the y-axis primarily is the level of the cytokines. We measured 51, and we found 17 correlating with severity. 17 of those markers of the immune system called cytokines, they were the higher they were, the more severe the illness was. And out of those 17, 13 of them were pro-inflammatory. So they were causing inflammation in these patients. And recent work by an outstanding researcher and professor of immunology at Yale University, Dr. Akiko Iwasaki, everything that is coming from her lab is just outstanding, is showing that when she takes healthy controls, here in the x-axis, horizontal axis, healthy controls, patients with COVID, but no long COVID, COVID controls, and those with long COVID, when she compares the long COVIDs, either with the COVIDs or healthy controls, there are more presence of immune activation markers, either in B cells, like these activated B cells, or T cells, like CD4 T cells, or cytokines, like interleukin-4, interleukin-2, interleukin-4, interleukin-6, in the long COVID patients that in the non-long COVID. So suggesting that underlying the long COVID abnormalities is an overworking immune system. Same thing here, the immunological differences in the myeloid, which is innate, as I showed you before, lymphocyte, which is the group of the adaptive immunity. And you could distinguish the persons who have COVID as controls, but versus those who had long COVID here, and the long COVID here on the upper triangle, having way more significant abnormalities in the immune system in the direction of pro-inflammation. The other fascinating thing that she found is that those with long COVID had higher levels of antibody against herpes viruses like Epstein-Barr, varicella zoster virus. Fascinating, because it's something that we also have found and suspected in chronic fatigue syndrome. And at the end, they have these fantastic ways to analyze data, but it's what is called unbiased machine learning. You give the data to a computer and you let the computer do the analysis on its own without any bias. And what the computer spits out literally is that they have these patients with long COVID that tend to have more presence of antibodies to Epstein-Barr, more immune activators in that. We did a study where we also found that the more severe the CFS patient is, the more likely that that patient is to be infected with CMV, herpes 1, EBV. So like if you are more severe, you are more likely to be infected. We suggest that that's also is in the direction of the role of herpes viruses working in severity. Lastly, based on all this work and the honor that I have been given to see patients over the last, now it's going to be 16, 19 years, I think that one can help these patients if brings to them a three-pillar approach where it includes lifestyle modifications, modulation of that inflammatory milieu, and then suppression on a long-term basis of the herpes viruses. Modulating within immune system drugs include drugs that are approved for other entities that are inflammatory. So one has to carefully discuss which of these agents will be more suitable to which patient. Suppressing the viruses, it would be appropriate if clinically indicated. There are patients who they tell us they have fluctuating viral syndromes. Fluctuating viral syndrome, this is highly suggestive of EBV. There are others that say when their oral herpes reactivates, their CFS symptoms are worse. There are others that have positive PCR for EBV and so forth. So depending on the patient's profile, one can attempt to suppress those herpes viruses as another source of ongoing inflammation. And very important is the not only decreasing inflammation with medications, suppressing the herpes viruses, but also lifestyle modifications that good sleep hygiene, low stress environments, and what we are going to be seeing control of the post-exertional malaise. I think that post-exertional malaise is not only a cardinal symptom for these illnesses, but is the biggest threat for any possibility of patient recovery and will be for success of clinical trials. We did a study of PAM with a group of collaborators, and we found that PAM can develop immediately or 24 hours later, and some patients a week later. So it really can be detrimental to the patient, and it can last few hours or it can last 1 week. And that brings down the patient's possibility, survivability for a recovery. And lastly, we also found in another work that we published the role of the gut microbiome associated with CFS. We found that bacteria like Faecalibacterium prausnitzii were low in patients with CFS and other bacteria like Rectale that produce butyrate. And butyrate is a highly anti-inflammatory. So again, the theme of inflammation seems to be supported by even if you look at in other compartments. So we found that the patients with CFS have lower producers of butyrate and lower butyrate. And the same finding was made by another group who also found low microbial butyrate. So in summary, is the way I think that we can view safely these long illnesses are highly inflammatory processes, and that inflammation can be modulated via lifestyle interventions, decrease the inflammation with immunomodulators, but also the use of lifestyle changes. And it's a pleasure and an honor for me to work with Christine Rosche that was introduced by Susan earlier on this aspect on how assessing the gut microbiome and how intervening the gut microbiome can be helpful for patients. So Christine, I will give you this patient that has these microbiome findings, and then please take it over from here.
Yes, thank you. I would like to do the case study, Dr. Montoya, after the presentation. So I want to do my slideshow first, and I really appreciate, thank you so much. That was an excellent talk, Dr. Montoya. And what I will be doing now is talking about the gut microbiome and the most important aspects of what happens to the gut microbiome with the virus, any type of virus during the pandemic, and how can we prevent and improve, boost the health of our gut microbiome. And at the end of my talk, I'm really excited to present with you the case of what a patient that Dr. Montoya and I worked together with, an actual case study. So let me go ahead now and share my screen here. So what I want to do, let me just make sure, just a moment here. So I'm just setting this up, okay. Just 1 second, please bear with me. Okay, so I will be speaking about the gut, the importance of the microbiome during the pandemic and post-pandemic, and also some of the issues that Dr. Montoya has addressed. So I want to specifically address what is the gut microbiome. We live in a symbiotic relationship with hundreds of trillions of microorganisms, viruses, bacteria that modulate every aspect of our body's functioning. So it's actually 10 times the number of cells than we have in the human body, and 150 times as many genes as we have. And all of the microbiome is in every organ of our body. So for example, we have The mouth has its own microbiome, you know, the esophagus, the breast, every organ of your body has its own microbiome, which also regulates how you're digesting and absorbing. So you cannot make the vitamins and minerals you need and really absorb your nutrients and have your immune system function, especially if you're getting any type of immune compromise, unless your microbiome is robust and stable, because you need it to be able to absorb your nutrient, manufacture your vitamins, and also make anti-inflammatory and anti-tumor factors. So how have things been altered over the last century? We all know about the, you know, industrial farming, pesticides, herbicides, GMO. There's been a significant increase, especially in the last 5 to 10 years, with changes in the gut bacteria that I've seen all across the board, working with people over the last 25 years. There's been a decreased diversity of our gut microbiome, an increase of the dysbiosis or bad bacteria related to, if you imagine you've got a desert versus a lush tropical jungle. So your healthy microbiome is the lush tropical jungle. However, when the bad bugs, you know, overtake that, you start losing a lot of the richness and the diversity. So diet, lifestyle, but most importantly, the type of water we drink, the air we breathe, and also the drugs. Even a small amount of over-the-counter drug lowers the ability of the microbiome organism. It impacts that ability to be robust. So people taking over-the-counter or drugs on an ongoing basis is going to really impact that. I am very concerned about the changes in our microbial garden, in that beautiful jungle that is our birthright, with the changes of the spraying of residual glyphosates, which are abundant now in all of our food, water, and air supply. So even if you're eating organic, the research I reviewed shows that all organic food contains a certain amount of Roundup or glyphosate. And of course, it's now no longer the clean 15 versus the dirty dozen, which we talked about for years. It's about a mandate, knowing that even the organic, even if you grow it, it's going to have residuals. So please focus on that clean, you know, clean 15 is no longer valid, because there has been a significant increase in the last 5 years, especially of what we have done to our environment and to disturb the ecology of the natural jungle, your own gut microbiome garden. So what's going on? We already talked about toxins, too much sugar. You know, of course, how you were born affects your microbiome, whether you were C-section or natural birth, you know, GMO affected, lots of things affected. However, when you look at the graph, there's been a dramatic increase, especially the last period of time in, you know, as we know with Dr. Montoya and these types of diseases that have impacted us with the pandemics we've been through. So according to a very well-known gastroenterologist, Dr. Desi, he researched this and found that healthy gut bacteria promote the functioning of T cells in your body. So the more robust, the more diverse, which I will talk about in detail how to accomplish that, the more you'll be able to increase your body's ability to be able to your immune system to be balanced. Bad bacteria, yeast, lower gut immunology, overall gut immunity. So the digestive system, your microbiome, is the root of your health. It's the root cause, and it's the key in fighting off bacteria, all types of viruses and fungus. There's also a very important connection between the gut and the lungs. It turns out that healthy gut flora during the pandemic were shielding people and the mucosa from getting more serious illness. So all the researchers, especially Leo Gallant, have found that the people that when you check the gut flora of people, whether they were outpatient or inpatient, especially during this pandemic that we had with this serious virus, that the colonization of the gut went right into the lungs. So whatever you have in your gut, you know, it's in your lungs, it's in every organ. And so they found actually that flus even and other viruses were reduced by 75% when people increased the diversity And of course, there's much more to that. It's much more in depth around really having a thriving microbiome garden. What does that take? That's what I'm going to be looking at. But there's a clear connection between the gut flora and protection of your lungs from viruses. The other is that you can test to determine the level of your gut immune system. You can see which bacteria colonize and which strains of bacteria that you need to boost your immune system. So one key aspect is it's absolutely now proven that the virus we were dealing with alters the gut microbes. There's a strong relationship between the gut microbiome and severity of the expression of this serious virus that we had. So 90% of hospitalized people had fungi, 3 species of opportunistic fungi. And as people got more inflamed in weeks 2 and 3, this was directly related to the diversity, richness, and what they had growing in the gut before they had the illness. So the key is strengthening and diversity and looking at getting rid of the weeds that are overgrowing in your jungle garden was a key to give that strength there so that you actually are able to ward off the funguses. Those people that had a barren desert terrain had very serious issues with Candida albicans, toxins, invasive Aspergillus flavus. Their whole system was overrun in the hospital with this terrible toxin that affected them, and that also led to some of the serious things that Dr. Montoya was talking about. All had to do with that basically the gut was a barren terrain and wiped out. So we didn't have anything to fight against this. Also brain fog, autoimmunity, inflammation, the pulmonary Aspergillus virus, which is very dangerous. There was a study done on that one, which again, people who came to this virus or other viruses with a barren terrain did not have any resilience. They were just showing serious overgrowth. Other than people who had a more resilient terrain had less of a response that was so damaging. Study at the University of Massachusetts showed the relationship of the gut and the mouth microbiome. So I am now exploring, along with researchers, to show that the bacteria in your mouth will migrate, of course, to the gut and vice versa, and that there was a correlation between the overgrowth in the stool and in the mouth. So the University of Massachusetts showed the inflammation, Enterocarpus fecale, increases in the stool and the mouth with infection of the virus, of this really serious virus. And then Med News in March of 21 actually showed that the microbiome directly affects how someone responds to a vaccine and increases the function of the mucosal barrier, modulates your immune response, improves your gut barrier integrity, and regulates, most importantly, also your butyrate levels and your inflammatory response, which Dr. Montoya and I will be speaking about. So one important thing is that Dr. Montoya, they mentioned F. prausnitzii, which we have found in all the research is very low in people who have this serious response to COVID and other viruses, whatever this terrible virus was. And people always say, well, are you going to take me to a shop and give me F. prausnitzii? How can I buy F. prausnitzii? Because it's a series of microbes that definitely lowers inflammation. It's an anti-inflammatory microbe, prevents allergies, respiratory infections, improves gum health, and also is responsible for people that have Alzheimer's and periodontal disease. F. prausnitzii is a key player in keeping the prevention of that. So what you need to do is take bifidolongum, BD536. So I'm going to be presenting some new research about the species. We're not going to go out and buy F. prausnitzii. We're going to look for a species called BD536, which has been shown to really mediate this response, help you lower the inflammation, increase your respiratory health, and improve your brain health, because we all know the gut-brain is such a key connection. The other is iodine mouthwash is very important in killing all types of pathogenic bacteria, as well as Bacillus coagulans, soil-derived bacteria, of which there are many different brands of that. Increases F. prausnitzii, lowers lung and organ inflammation, which is such a key factor here. One of the things that's very important, all the people in the studies, alkazide D128, protected against influenza virus. So actually showing in the lab how a virus strain, the viral load of the infected animals for H3N2 was significantly lowered. So what I learned from doing all this research, speaking to some of the Harvard-trained doctors and on the East Coast, is that basically by keeping a healthy, diverse microbiome with a high level of F. prausnitzii and a high level of the core players that we're going to talk about when we do our case, will actually suppress the proteins and lower your viral load. So across the board, every researcher that I spoke with said that the virus can enter, whether it's influenza, colds, flus, or a terrible virus, but the expression is directly influenced by the type of probiotics and the health and diversity of your microbiome and the composition of your microbiome. Also, your gut barrier is critical. Probably many of you know about leaky gut permeability. You need to, of course, also do everything you can to keep a healthy mucosal barrier, therefore have a very healthy, robust gut immune response with the SIG-A, which with the testing I'll talk about measures how robust your gut immune response is. So again, one of the key factors in the nutrition, the diet, was for people to eat many different colors of vegetables every day. So the research found that polyphenols, flavonoids, black rice, purple foods, especially during the most difficult time when we have a severe virus or a pandemic, the diversity of what you're eating, prebiotics, which I'll go over in just a moment, resistant starches, like green banana flour is a simple supplement you can put in your smoothie, but it boosts this essential fatty acid production, increases butyrate, which will lower your inflammation. And then anything that's purple cabbage, purple potatoes, black rice, black and purple was the staple of these physicians that I worked with during the pandemic as a way of also boosting their immunity. So it's really a key, the diversity inside your microbiome, what you eat every day, and how, that interfaces your diet with that. So the top immune boosting foods during that time and now are, of course, the vitamin C, the bioflavonoids. The research shows if you're doing higher doses of C, like 5 to 10 grams a day, the expression of serious viruses is affected, much less. Garlic, allicin, ginger decreases inflammation, green foods, anything. What I always recommend in my clinic, digestive health center, is where people make a gelatinous veggie broth. We don't use the carton veggie broth that's in your Safeway store. We use in a glass jar, we get that gelatin broth and we put it in a big pot and would show people how to put in all the dark leafy greens, bok choy, kale, rainbow chard. And then what happened is that before the meal, they would eat prebiotics like cultured foods, cultured kimchi, sauerkraut. Consuming the veggie broth was such a great way to heal the lining of the intestines, as well as improve that much more of a robust gut immune system by what you eat every day. So bone broth, leafy veggies, cultured coconut yogurt. For those of you living on the West Coast, there's a product called Coconut Pulp, just an example of a product that you can eat every day that really helps you with gut health. Here are some prebiotic essentials. These are things that will help you make more of the pro-inflammatory microbes, anti-inflammatory microbes, but prevent those pro-inflammatory ones from growing. So again, diminish the bad weeds in your microbiome garden, improve the anti-inflammatory microbes by eating pistachios, asparagus, cultured yogurt, kimchi, beet kvass, garlic, onions, very diverse essentials that we need for really creating a thriving microbiome jungle garden. And the biggest factor is, in order to prove this, they did a lot of research showing that even one candy bar, one soda reduced immune response to viruses all across the board by 70%. It reduced the neutrophils in gobbling up the bacteria, and there were long-term effects. So within 24 hours of eating white sugar, this is what we know. If you want to stay healthy, and the diversity of the microbiome was also affected by eating sugar. And so again, pharmaceuticals, drinking tap water, which is of course loaded with all of the things that will decrease your microbiome and make the dysbiotic bad bacteria grow. So we have, the quality of the water, quality of the air, and we have the sugar as being a key player in this. So food is medicine. So remember, what you're doing is improving the air you breathe. I noticed, for example, every clinic that I go to now is an air filtration system, first time ever. So, air filters, water filters, definitely removing the tap water shows in my research across the board to, really helps when you remove the tap water. And then look at where you get your produce. We know it all has, some Roundup. So how to really be present with that. And they even found that custom probiotic strains, infants birth to 1 year, 50% reduction in colds and flus. So the key is you can't just go to a shop and buy any kind of bottle of probiotic, because I'll talk about that they actually need to be customized and individualized for your unique microbial garden. Most importantly, I'm working now with a couple of researchers and dentists that the recent area of microbiome linked to the oral cavity, most of you know that. However, inflammatory bowel disease, Crohn's, and ulcerative colitis, 80% of Crohn's patients have symptoms of oral disease. And so the key is look in your mouth first, make sure you've got a good biological dentist, and get regular care for that. And then realize that the microbes of the mouth, which we can now test, are a key player in whether or not you're going to have gut or other chronic disease. So across the board, arthritis, also rheumatoid arthritis, heart disease, RA, and diabetics were linked to pathogens that started in the mouth. So what we have to do to look at the root cause, like in functional medicine, let's go to also the oral bacteria. And the great news is now I'm working with a company and a few dentists to bring you the DNA oral bacteria, the tests that you need to measure at home. You just swab the inside of your mouth to see what your oral bacteria actually is, and then be able to balance the oral systemic connection, that you lower the pathogens in the mouth to lower your risk of chronic disease. So I want to go now into some very exciting information that, why guess about what's going on in your mouth or in your gut when you can actually test it? So what we now have, we have tests to determine the level of your gut immune system, CIGA, to determine which bacteria colonize your gut and what strains of probiotics you need, very specifically to boost immunity and to prevent viral infection. So you can measure your oral microbiome with saliva samples and oral DNA. You can use probiotic toothpaste and chewable dental probiotics. And I include that in my consultation with people, what probiotics to use in the mouth that you use after you brush. It's also very new, exciting research. And I really have done much work the last 20 years with functional digestive stool analysis, where you can discover the beneficial and the bad bacteria, identify gut immunology, leaky gut and inflammation markers, and all your digestive markers, all in the privacy of your home. There's a kit that gets shipped to your house all through the US, even in Europe. I've worked with many clients there, identifying what's really going on in the landscape. You want to have a map of your garden, map out what's happening in your jungle garden. So the benefits are it's non-invasive, it's early markers of detection. This test detects inflammation years before someone would get a serious disease that would be identifiable by a scope or a colonoscopy, which is still very essential. Follow your doctor's guidelines. However, it's very cost effective, it provides lasting solutions, and it's early markers of gut function. You want to know where you are, right, before anything else happens, to prevent chronic effects of all types of pathogens. And so you get identified bacteriology, mycology, occult blood, you get a colon cancer screen with it, CIGA, inflammation, immunology. And so there is the comprehensive test. which identifies all of these things. There is the breath test for small bacterial overgrowth. There's also food allergy testing and intestinal permeability. You can do a urine in-home test to see how permeable or not. You can do a stool test, zonulin, to see whether or not your level of permeability is. So detecting H. pylori is critical because it's such a key. People who had the virus sometimes had H. pylori and didn't know about it. So we're looking also at low gastric acid production. I do an in-home test that's very simple that I give you. Do you have enough stomach acid? It turns out that you must have enough hydrochloric acid in your stomach to be able to break down your protein and also keep your gut flora in check. The people who had chronic gastric acid deficiency actually were able to have, we showed an imbalance between the gut microbiome and very severe inflammation with people who don't have enough stomach acid. And over the age of 55, your stomach acid declines. So I will teach you how to assess that, how to assess your stool transit time, how much time does it take from when you eat your food to when you actually have a bowel movement. And most importantly, to know that non-steroidal anti-inflammatories actually affect all types of gut flora. However, especially if you take a PPI, a protein pump inhibitor, it is known to really affect the ability of your body to digest and absorb your nutrients. So I see patients, it's a fantastic drug short term. The Digestive Health Center, the physicians I work with, we say, yeah, take it for 6 months, whatever the doctor orders. However, I see patients who've been on it for years. They can't get off of it. They're no longer producing their own stomach acid. They have severe nutrient deficiencies. They're not absorbing. And so the use of some of these drugs, unfortunately, which is very important short-term, has used long-term, inhibits your ability of your microbiome to flourish. Your microbiome cannot go forward if you're on these drugs for a long time. So also, as I was saying, what I'm going to offer everyone here is I'm offering you, I have my phone number up on the slide, 650-856-3151. If you're in the US, or the digestivehealth.center. So my website again is digestivehealth, HEALTH.center. Call me at 856-3151 or send a form. We have a contact request form on the website. And I'm happy to speak to anyone on the call to help you customize whatever you need and also give you a significant offer on the digestive testing. There are many tests. And for everyone, I have a gift, which is a 15-minute complimentary introductory meeting on Zoom or by phone to just talk about your situation, see, what's happening with digestive testing for you and so on. My most important takeaway for all of this that I think is so critical is that you really need to pay attention to the entire picture, as Dr. Montoya was also saying. It's not just about one level. You have to really analyze and see, what am I eating? What air am I breathing? Air, water, what am I eating? The level of pesticide exposure. How is my microbiome impacted? And most importantly, I'm encouraging you to take advantage of the latest technology, which is assess your microbiome in every area of your body. It turned out that the microbiome in cancer patients in different areas was very different than it was in people who were healthy. So take an early detection approach, look at your mouth, take the mouth test, take the gut test. Every year in certain countries, they do a gut analysis to make sure that you can really cultivate that healthy microbiome. So I want you to leave you with this, that there's some very exciting news. You too can be really resilient, cultivate a very diverse and rich microbiome garden, and improve your immunity. Now I would like to discuss the case with Dr. Montoya. Thank you so much. Please bring up the slide, Dr. Montoya.
And
we want to do the case now. The case he shared.
Sorry.
A case study.
Sorry.
Yeah, that's a patient we did together. So Dr. Montoya, you want to begin by giving a little bit of background on this patient? Yeah.
Or on mute.
It's a patient who developed a long-term illness from an inciting event. And with all the symptoms that we mentioned, the fatigue that does not go away with rest, post-exertional malaise episodes following cognitive or physical, the unrefreshing sleep, and lots of brain fog. Is, every case that you see with all these symptoms that you could call chronic fatigue syndrome, myalgic encephalomyelitis, chronic Lyme disease, long COVID, is devastating to see, because it has been shown that they suffer as much as a patient with cancer, as much as a patient with a cardiovascular event. The huge difference is that they often are humiliated by providers and the medical system who do not believe that they have those symptoms. So this patient presented with those symptoms, and I invited Christine to, and patient obviously called her and accepted the invitation to analyze the microbiome. On this patient, we are doing the tripartite approach. So we are using anti-inflammatory drugs, we are suppressing herpes viruses, and there is a positive, really good response. And at the same time, lifestyle interventions that include avoiding those PEMs, and also the intervention that Christine is a magician, with the diet and analyzing the microbiome. So Christine, this is the patient's microbiome, main microbiome findings.
Yes, thank you. So this is the GI 360, which is one of the microbiome very comprehensive DNA PCR assessment. So this one here shows, his microbial fingerprint. So when you see the white overlay here, that's his microbial fingerprint, and the hexagon would be if the microbes were in balance. So what we did find, as his diet had been very poor, is that, for example, he was quite low in butyrate producing bacteria. So when you look under the key findings, there's an insufficiency in butyrate. He's also had, some issues with the whole issue of the butyrate, the intestinal permeability, being able to, have a lower inflammation through his membranes. And he also was lacking diversity of the microbiome. So Dr. Montoya, let's go to the F. prausnitzii now. So the first page shows you some of the key findings, the butyrate deficiency and the microbial imbalance. But now what we see is, look at this, Eubacterium hale in the blue, very deficient, F. prausnitzii very deficient. So this was, of course, one of the most important aspects that Dr. Montoya and I looked at, is how can we raise his F. prausnitzii? And so the key was to look at his diet. He ended up going from eating a lot of very bad foods to, within 3 months, having a personal chef service, and also ending up changing his diet to more whole plant-based diet as opposed to sugars and carbohydrate, which would also by itself, having plants, would increase F. prausnitzii. If you have bone broth plants, the rich diversity of the gut is increased. But also what we did do was to look at, in addition to that, special soil-based probiotic strains based on his microbial fingerprint. So we have like 5 pages that we're showing you just the core here, but there were 5 pages of microbes, and then his, gut immune system evaluation. So the combination of him changing from a meat-based, high sugar diet, high carb diet, refined carb, to a plant-based diet, already changed the cultivation, took many months. Then we gave the probiotic species, working with the gut itself, gut membranes, by helping him heal that permeability, more bone broth and so on, but also increasing the diversity of the species while managing multifaceted factor of the vagus nerve system and the stress dysregulation. Yes, and then here, very important, here we see microbiology, the imbalanced bacteria. You see the yellow arrow. So what his bacteria showed, his imbalance, the Streptococcus and others could any moment, as he was pushing further and further with a very diet that was really raising his inflammatory, all of these imbalanced bacteria start to jump into a red, inflamed dysbiotic bacteria. So he was cultivating, in a sense, his garden to become very inflammatory. And they showed up on the test. And then most importantly, the test shows the elastase, digestion absorption. He showed his pancreatic enzyme was sufficient. However, his fat stains, which means he was unable to absorb fats. He needed assistance with the digestion of fats. And then, of course, we also see, fat digestion, we see his secretory IgA being quite low, his borderline, and then his butyrate. When you go down to the butyrate marker is extremely low here. You see the butyrate 0.83, that should be about 2.0. So he's demonstrating very low capacity for any kind, his inflammation is much higher because his butyrate is basically not there. So we're using the food, the microbial diversity, the injecting better microbes, and then also giving butyrate in some cases to really equalize this and increase the butyrate. May have to be supplemental butyrate with some patients.
That's it, Christine.
Yes, thank you so much.
Yeah.
Okay, great. Now we have the questions, I think, that is really, yeah.
You want to go through them, or do you want me to go through them?
Yeah, please go through them. I think, how do you feel, Dr. Montoya? I think it'd be good to have her.
And also, people, you can raise your hand, and either Christine or I will try to ask you in the order that you raise your hand, but sometimes that doesn't work. And, or you can text something in the chat and we can go that way. But the first question here is, how can you suppress herpes?
I believe that's a Dr. Montoya.
Right. So thank you for the question. There are FDA approved for oral medications that can suppress them. It's a relatively long-term game. It's not a few weeks, few months. I have estimated that it's probably something between 1 and 5 years of suppression until the immune system of that person learns to do the job that it did before the illness began.
So how is that done again?
So there are 4 FDA approved medications.
Like acyclovir and things like that?
Acyclovir or valacyclovir or famciclovir or valganciclovir.
Okay.
Correct.
Okay. Another question was about spore probiotics.
What is the question?
What is your recommendation on using spore probiotics?
There are many different types of spore probiotics. What I find is that when I do a screen of the digestive system, there are certain people that really benefit from those. It depends on the medical history, how you're, like, for example, do you have a gut disorder or not? So if somebody's really healthy, if they have so it's very individual. I think spore biotics are great, but not for everyone. So the person would have to contact me about, I would probably talk to somebody about their medical history before recommending. But I think overall for a healthy person, that does not have IBD or ulcerative colitis, where we have to be very careful, or, other serious disorder. If somebody's healthy and they want to try spores, there are many kinds of spores. So again, I encourage you, but with caution, depending on what you need.
Now, here's a question. I mean, in the back of our tongue and in our sinuses, there's certain bacteria that will convert nitrates to nitric acid. And somebody's asking, how will iodine affect that? Because if you take mouthwash, it wipes them out. So how would iodine affect that?
Well, I have, the main thing is that, yes, iodine does wipe things out, and it would depend on for that person's specific goals. I think the physicians that I work with use iodine during a pandemic as a way of prevention, with drastic measures. This was used in a very serious time. They're not recommending routine iodine mouthwash. So I want to make it clear that people exposed to this terrible virus or other crisis intervention was the iodine mouthwash at the time. But there are many mouthwash, and when you do your culture of your oral microbiome, they give you recommendation on which toothpaste, which mouthwash, so it's very helpful to know for your unique. Again, this is all customized with your mouth, but no, do not use it all the time.
Now, here's a question. People with high histamine are told not to use fermented foods. So what is your recommendation?
So with high histamine, are told to, say that again, Susan, not use?
Okay. Well, let me go back to another question. It's another one on iodine supplementation. And there's been a lot of word out that it's not good and it's detrimental to Hashimoto's. However, iodine is so important for various functions in the body, the breast, etc., the thyroid, that my own personal opinion, which has changed in the last 10 years, is that it's more you have to weigh pluses and minuses, but some people say that the iodine does not adversely affect the antibodies in Hashimoto's. And my conclusion is that it's far more beneficial to take the iodine if you've got Hashimoto's, but you can experiment. I mean, that's my personal opinion. I'm not giving medical advice. No. But anyway, anyone have any comments on that?
I want to go back to the high histamine, of course.
Okay, let's go back to the other question.
The high histamine foods, anyone that consults with me or the center that I do, we always take that into account. We do an in-depth assessment. If somebody has histamine reaction, we would recommend foods only that are, for them, that are very important to keep that into account. Do you have any, Dr. Montoya, about high histamine reaction to foods?
I think it's primarily also on an individual basis. It's also a matter of trial and error. But for some patients, fermented foods are not the food for them because it will have highly complex, things that come with the fermentation. So I would say that even with high histamine levels or not, fermented foods are not for some patients.
Yeah.
Okay. Now, if somebody asked what to do for low stomach acid, I think the first thing to do would be testing it. And as I understand, if you take betaine or something and you don't have any problems with it, you've got low stomach acid. So I'm guessing that's going to be the answer, but I'll ask you as experts.
Okay. Well, I found that, of course, like Susan says, test first. But then I also find there's such a diversity of digestive bitters, but generally speaking, we give people HCl or apple cider vinegar for those patients that do not need to take HCl. It's too strong for them. They do a teaspoon of apple cider vinegar in a quarter cup of water before their meals when they consume mainly meat. So anytime you're eating animal products, you need to have the HCl to break it down. So if you take a little bit of apple cider vinegar and water, that may be enough. For other patients, we found we need to give them HCl capsules combined with bitters, combined with a more digestive broad spectrum.
Now, there's also a question: is somebody with low stomach acid, what should they eat? I mean, obviously, the best thing to do is raise their stomach acid because it's so intricately important for every other digestive function, enzymes, the valves in various places. I mean, but what food would you recommend them to eat while in the transition till they can increase their stomach acid?
Well, I feel the same way as what you said. I think that you're going to need that stomach acid for breaking down the food. However, obviously, if you're eating non-meat products, you know, like if you're eating vegetables and plants, then of course less hydrochloric acid is required. It's when you start eating meat of all kinds, chicken, fish, or turkey, and also eggs, you know, require much more stomach acid. So if you're staying very plant-based and you drink green juices all day, then you may need less. But for the diversity of your microbiome and your health, in order for your microbiome to stay healthy, you need to have enough stomach acid.
Okay, here's one question. How do you distinguish between cold sore herpes, which I assume is herpes 1, and genital herpes, which is herpes 2, and there's up to 6 different kinds of herpes. So it's really, you know, creating all sorts of challenges. But how would you distinguish? I mean, I think they can do testing to find out which it is. But, you know, and what do we do with the differences? What would you do with the differences?
Yes, there are blood tests that you can find which herpes an individual has been infected with that are reliable. There are 8 herpes viruses that can infect humans. One is the type 1 of the cold sores in the lips. Type 2, herpes simplex type 2 is the one in the genital areas. Usually, type 3 is the herpes 3 is the chickenpox and shingles virus, which is the same virus. This is herpes 3. Herpes 4 is EBV, Epstein-Barr. Herpes 5 is cytomegalovirus, CMV. Then we have herpes 6, herpes 7, and herpes 8. For all of them, you can identify them by looking for IgG, the presence of IgG against any of the proteins. For Epstein-Barr, we can have IgG against 3 proteins, the viral capsid antigen, the early antigen, and the eBNA, to see if the virus is reactivated in the traditional sense. We look for IgM, PCR. For EBV, we look for early antigen. And then I pay attention to the levels of the titers, like Dr. Iwasaki's research. The level of the titers can be also an indication of reactivation. The oral herpes would be primarily in the oral area, lips, usually in the same place, though there are patients who can have the herpes 1 in the genitals. And the genital herpes usually comes in the same place, in various places of genitals, of any type of genitals. And some patients can have the genital herpes in their mouth as well.
Okay, let's take a break from the chat and let's go to people who have their hands raised. So Dion, why don't you ask your question? Be sure to, go
okay.
for it.
Thank you for the presentation. It's amazing and so interesting. There's so much to learn. I am curious about the microbial environment of beyond our bodies and how they interact. So not only our food that we intake, but the soil that we touch, our home environment, our kitchen environment. Can we curate this environment? And an additional question on that is, when we travel to a different country, is that presenting our system with novel microbes that actually create a lot of stress to the system? For example, if we're traveling a lot, if we're someone who's traveling constantly, is that in a way, from maybe an indigenous perspective, not a good idea, that we should actually be localized most of our lives? Thank you.
I'll let you answer that first, Dr. Montoya.
Yes, thank you, Dion. Great question. So it has been shown that, as you mentioned, in addition to these trillions of bacteria, like Christine alluded to, that we have more bacteria than cells, there is a complex dialogue, conversation between our microbiome in the gut, skin. We also have millions of bacteria in the skin, and also in our lungs, in our nose. there is a complex conversation that goes between our own bacteria as humans with the bacteria in the and fungi in the forests and the trees and in our pets as well. Well shown that children who grow with pets have more diverse, which is healthier, microbiomes than children who do not grow with pets, with dogs specifically is what it has been looked at. And it is believed that these things that happen when we do walks in nature, in some places has been called forest bathing, like bathing yourself in forest environments. And that peace that comes with walks in natural environments probably has to do with our microbiome interacting with the microbiome of plants and those organic entities. So you bring up an important point. What happens when we travel? This is like, what happens like in our own environments. Like I love, for example, take a walk in the mornings with my wife is one of the most pleasant activities that we share together when we leave the house. And so, but what happens when we travel? Now we add changes in the time zone, changes in the diet, obviously, when we travel. And so that brings another level of complexity. I will suggest this, and for with what I just said, there is good supporting evidence for that. But for the question that you pose, which we clearly don't have data because it would be impossible to separate the jet lag from the diet, from the stress of travel, even if you do it, carefully with the right person and all that stuff, that the more inflamed you are in a situation, to avoid those exposure to those environments, because it's very likely that your immune system microbiome that is tied to the microbiome will have less flexibility to take the challenges of the new microbiome interactions. And the more you are on the resting healthy state, the better will be that you get exposed to those. So your microbiome will have these healthy interactions that will bring more plasticity and more flexibility.
Yes, and I would add to that, the growing gardens, they found, having children grow their own gardens, their own food, the interaction of children, both with the pets and with their hands in the soil, and to interact outside as much as possible, of course, again, creates that as Dr. Montoya said, that flexible state of more of a healthy state.
Thank you.
Okay. Any more questions, Dion? Okay.
That's it. Thank you so much.
Okay, Joanna, you're on.
Yes, hi. I had a question that I wanted to ask Dr. Montoya. I've been dealing with Epstein-Barr and persistent Lyme for a long time, and then a year ago got COVID and have been dealing with either long COVID or reactivation of the other buggies since then. But I just had some blood work done, and some tests that have never shown up positive have shown up positive on them. And I'm wondering if these could be related to COVID or long COVID in any way. The cryoglobulin QL was high, complement total was high, PTH intact was high, and my ANA screen came back positive for the first time. And unfortunately, I have a doctor who doesn't believe in Lyme or Epstein-Barr, or that there's anything that can be done for long COVID. So
sorry, Joanna, that not only you have been battling these issues related to EBV and symptoms of chronic Lyme disease, but now with long COVID, and on top of that, you have to face providers that don't believe this illness for you. It is a real entity. Having CFS or chronic fatigue syndrome or ME or long COVID is real, and you know, one of the things that I have said before is that my dream is that one day the medical community, medical societies will apologize to patients for what they did to them, because it cannot be more, bring more suffering, not only having seen your life devastated, but also not being believed and being told that it's nothing that can be done. Lots of the tests like cryoglobulin, P.H intact, anti-nuclear antibodies, the so-called ANA antibodies or ANA, complement, as you mentioned, lots of them in many patients can come up normal. And then when you go and do the workup that traditional medicine will do, if you have complement abnormality or cryoglobulins, like in your case, or the ANA, the ANA, not infrequently that workup does not reveal anything conventional. And, you know, it's the medicine of the silos, right? So either you have to have a rheumatological illness, you have to have an endocrinology, you know, well-defined endocrinological or neurological. And if you do not fit that box, that silo, then it's not like, I'm so sorry that we are failing you in medicine by not knowing what you have, but at least I acknowledge that you have something. It usually is not like that. So those abnormalities are not infrequent, and fortunately, Joanna, we cannot tell whether that is coming in from the EBV side or from the Lyme side or from the long COVID side. We cannot make that connection yet. But we know that in the three entities, in the three groups of patients, we see this often. And occasionally we see a sedimentation rate, a C-reactive protein. But the idea, Joanna, is to still implement this lifestyle modification. Please pay attention to the lifestyle modifications as I try to convey this post-exertional malaise phenomena. Patients get worse after they do more than they can, and that what they can do more than they can varies from day to day. It's really tough. Is the biggest threat for a patient potential of recovery. If the patients can conquer the ability to not exceed that mysterious threshold of energy envelope every day and be able to function without having the PM exacerbations, that's a big step, important step in the right direction. And that's going to be tough for clinical trials. And then the diet and that we talked about and that Christine mentioned, and see if you can work with your primary care provider. There are some few things that they might agree to in terms of inflammation, antihistamines, antihistamine type 1, antihistamine type 2, like Pepcid, that does not affect the acid level, like the proton pump inhibitors as much. Use of medications like Celebrex long-term, low-dose naltrexone, those things that bring inflammation down. It's harder to convince them because, you know, I suggest this to those who want to have their medications covered by the insurance companies, but some of the primary care providers will be open to suppress, for example, the Epstein-Barr virus with a relatively safe medication like a cyclovir for at least a year. And what I have noticed is that if you use one of the three successfully, one of the three components of the approach, there are patients who successfully leave this thing behind by using one of the three. If they use two, there is a greater chance. And if they use the three, is where I have seen that there is the greatest chance of recovery. But yes, Joanna, going back to your original point, those cryoglobulins, P.H intact, the complement, the ANA antibodies can be seen in any of the three.
Yeah, I've had the Epstein-Barr for over 40 years, and I've had the Lyme for well over 20, probably close to 25. And none of those things have ever appeared before. And that's why I was thinking that they might be the COVID on top of everything. And I'm also wondering if you have any non-pharmaceutical suggestions for long COVID, especially the brain fog and fatigue.
I think that we could you could try looking at the microbiome specifically and see if there are good evidence that in your case specifically the butyrate, the Faecalibacterium thrapsnitzi or the Eubacterium rectale, if those are on the low side, that because there is a lot of communication between the gut and the brain that is becoming more and more recognized. There are trials now for fecal transplantation, for fecal FMT, fecal matter transplantation in some of the diseases like Parkinson's. And so I will explore that part significantly, try to decrease your inflammation in the gut that will transfer into decreased inflammation in your brain. I don't know the long term, but you could try natural agents as antivirals like L-lysine, for example, that is known to have antiviral effect. Yeah. So sorry, Joanna, you have gone through.
Great. Thank you so much. This is a wonderful talk.
Sure. Thank you.
Okay, Jennifer. Well, I've asked her to.
Sorry, can you hear me?
Now we can, yes.
Oh, so sorry. It took me a moment there. I wanted to ask about, grains, different grains, whole grains. What impact do they have on these conditions?
So Jennifer, I've done a lot of work in that area. Thank you for asking that question. I find that with the high inflammatory conditions, especially gluten grains, be aware that also the most grains are sprayed now, unfortunately, with glyphosate. So unless you live in a pristine part of Europe where you're still getting it, but here in the US, all of the grains are heavily, affected by that, even the organic grains. And the research all shows, yes, let's say, some people want to eat a small amount, but they definitely would make it like gluten-free brown rice, or maybe they, get really clean quinoa or something, but it's all clear that grains that do contain gluten that are across the board, usually many people is an issue with the kinds of things that were being talked about here.
And what do you feel about things like, now, isn't all brown rice gluten-free?
Yes, it depends on the source. Again, you have to really look at, yes, it is. It depends. I mean, brown rice contains other things that people have found toxic elements. Nothing is perfect. But I think when you're looking across the board, choose some clean, gluten-free, grains, and having small amounts when people have inflammation, especially with the type of diseases that we're dealing with here. And I found also by the way, with the psoriasis, someone was mentioning gut health and psoriasis. I've had really good success with patients that had psoriasis even throughout their whole body by looking at the microbial map to see exactly what their garden looked like. We saw that they were eating the very foods. They were actually continuing to increase the inflammation on their skin, were brought in the bad things that they didn't need. But within a year, these people had a 90% reduction in psoriasis by working with all the levels, of course, gut health, whatever they needed on a medical sense, nutrition, they worked on the nervous system. But I've been very pleased to say that there's a strong correlation between psoriasis and other disorders and the composition, not just the composition, but the entire diversity of the microbiome and what's going on. As well as toxic chemicals, because somebody mentioned that, you have to look at air fresheners, you walk into an office these days, everything's sprayed with toxic chemicals. Every bathroom, most bathrooms I go in at restaurants, not all of them, but the majority, we're learning, but plug-in air fresheners and then add to that all the sprays, Windex, what we've done. So for the man who asked about, the home and kitchen, by all means go green, and know that the psoriasis patients all had exposure to toxic chemicals on their skin. The women were using chemicals that were damaging at every level to their skin. And so we live in such a toxic world that you have to be really careful to go into your kitchen and the rest of your house and see how you can clean out the toxins.
I have one more quick question, and that is, should you take things, if you want to supplement your HCl with apple cider vinegar or HCl supplementation, should you take those separate from, say, your kimchi or your fermented product or your probiotic?
Yes, definitely. You want to do your probiotic depending on which one it is. Some of the ones I use you have to take with a meal, some you take without a meal. So that depends on the microbe you're taking, but definitely HCl is meant to be taken at the onset of a meal that has protein, animal protein, eggs, chicken, fish, and kimchi needs to be before the meal. So you want to most enjoy your prebiotics like sauerkraut at the beginning of the meal or between the meals. That will have the most impact.
And if you take the HCl at the same meal that you may have had some kimchi or whatever before, will that destroy the probiotic, or will that be okay?
No, that should be fine. Yeah.
Okay. Thank you.
Okay, returning to the chat, the next question that comes up are, what are the key recommendations for rheumatoid arthritis?
So yes, so that would be if it's diagnosed with some of the markers, first clinically, always clinically, with the symptoms, with the morning stiffness, with the examination of the joints, and then some of the imaging studies will show the destruction or the early involvement of the joints, and there will be tiers of drugs, and usually they tend to be called disease-modifying medications that not only will bring down the inflammation, but that will also, or the symptoms, but also will make the patient's life comfortable over the long term. So that will depend on the patient situation, that specific medications will be given. But everything that we apply today in terms of inflammation will apply to those patients in terms of lifestyle modifications and the use of these medications. But it is highly dependent on the situation of the patient about specific medications.
Okay. Comments about the types of vitamin D to include in a program to improve gut immune health.
The first thing I recommend is to do a D3 test with whoever can do a blood test. Some of you can get in-home D3 tests. Depending on the level of your D3, there are many different, more easily absorbable products available of D3. So some people do under the tongue D3 with K2 because it's much easier to be absorbed. The two of them together in general, my clients who take a lot of supplements or drugs like sometimes just to drop the liquid D3, but it has to be measured every 3 months. If you improve the D3, you need to have a baseline of the D3 level in your blood, and then also work with your physician or healthcare provider very closely to increase that dosage until you're at the right level. During the time of the bad virus that we know about, they recommended having a D3 of 60 to 80 at that time. So if your D3 is below 50, then you want to pay attention. And I'm happy to talk to people about that privately. It's a whole process, but there are kits you can order that you measure in your home, or you do the blood test with your physician.
Now, here's a question I don't totally understand. If someone wants to be a subject in a systemic inflammation after long COVID study, oh, pardon me, that's my error. If somebody wants to be a subject in a systemic inflammation after long COVID study, where do you recommend looking?
I interpreted, I looked at the question earlier as a perhaps like if they want to be looked at as part of a study, that would be one possibility. For studies that are obviously depend on where you are. If you are close to New Haven at Yale University, I will highly encourage joining Dr. Akiko Iwasaki's studies. I think that Dr. Akiko Iwasaki is a fresh presence in the, because she really has not only highly scientific skill, but the desire to really understand what happens to patients whose lives get destroyed or affected after having an acute infection, be that Epstein-Barr, be that Lyme disease, be that COVID. And she has an amazing team. So there, NIH has studies. I live in Menlo Park, Northern California. I know Stanford has also studies that are ongoing there. So be on the lookout, because there are lots of places. The NIH, for the first time, gave $1.25 billion to study long COVID. One hopes that money is well used, but for the first time, money that never was given to CFS, the most money they gave in 1 year, it was hilarious. It was like $5 million for CFS. But so look for studies that might be close to where you are, and hopefully you find a compassionate provider that will be willing to listen to you, validate you, and work with you.
That somebody was curious about how the method of birth can affect your health, but obviously it affects the microbiome, because you get a lot of the bacteria from the mother as you come down the birth canal, and from breastfeeding, etc. So do you want to add more about how the method of birth can affect health?
Yeah, I think the C-section babies, there's definite correlation, when you look at the amount of different types of health-related challenges that these children have as they're growing up. The children that are born vaginally are inoculated at that time with especially the bifidus, the lacto that they need to start processing, even the formula, the breast milk is giving them so much that they have natural immunity from the very beginning to many things that the C-section babies did not get that exposure. So it's very clear that they're more vulnerable from the very beginning to different types of health challenges.
Does apple cider vinegar in water negatively impact tooth enamel?
Good question. It depends on the ratio of the water to the apple cider vinegar. That is correct. There can be an impact, but I think if you dilute it and it normally there's not too much of an impact with the right dilution. But if you did it, all the time without the diluting it, yeah.
Do you treat viruses with highly elevated IgG but no IgM antibodies in chronic illness patients?
Dr. Montoya, I can't hear you.
The short answer, thank you, Christine. The short answer is yes. In the study by Dr. Iwasaki, the patients who had long COVID compared to those who had COVID but did not develop long COVID, and those who were healthy controls, those with long COVID had higher antibodies against VCV, the varicella zoster virus, the virus responsible for chickenpox and shingles, and also elevated levels against EBV, the Epstein-Barr virus. It is very hard to believe that the immune system will devote more IgG to something unless something is not happening with that something. The IgG has limited capacity. The total IgG that an individual has is divided into IgG against a bacteria, IgG against another parasite, IgG against an allergen, IgG against aspergillus, IgG against CMV. So it's shared into many things. So the immune system does not elevate the IgG fortuitously, just for the sake of it. So yes, I guide those who are candidates for herpes suppression also based on the levels of the IgG, even if they are IgM negative or PCR negative. Thank you for the question.
There's a question about treating type 1 of what? I don't know.
Okay, can I interrupt? This was my question. So the first time I asked the question, I'm sorry, I wasn't very clear. I wanted to know the distinction between type 1 and other type herpes in terms of the treatment, not in terms of diagnosis. I know the tests give the diagnosis, but how would you go about, like, is there a long-term treatment for type 1, which I believe the majority of people have it, like the cold sore?
So the type 1 is about 30% of the general population who has it, the most 35%. Genital is about 20%. So for the type 1, I have had patients who have had these illnesses, CFS or long COVID or chronic Lyme, and when they feel like the herpes 1 is going to come up, and it's usually the numbness, the tingling, the symptoms get worse. And I've been fortunate to have met such patients and fortunate to have suppressed that reactivation with the oral medications, and then eventually plus the lifestyle modifications, plus the reduction of the inflammation, they have really good significant recoveries. The suppression of the herpes 1, if one chooses the pharmacological route, can be with either acyclovir or famciclovir or valacyclovir. If it's only the one that one is targeting, then I try not to use valganciclovir. That one is more for like CMV or herpes 6. So, and the other thing, in a study that we published, we showed that the longer we gave the suppression, the higher was the chance of recovery. So there was a study done in the 70s where they suppressed EBV Epstein-Barr for just 6 weeks. And that study declared that there was no role for viral suppression because it was negative, 6 weeks. And I did a study where we did it for 6 months and we found the difference there. But I wish we would have known more then, and I would have done it for a year. It's usually a year. So not only for your question, it's important to choose the right antiviral to suppress. As I mentioned, there is some role for the L-lysine as a natural suppressor or these drugs, but also key for the success is the duration of the suppression of the herpes virus that, in my experience, needs to be at least 1 year.
There's a question on treatments for long COVID, but as we know, there are protocols like with the frontline doctors, Dr. Corey, Dr. Merrick, Aaron blocking on his name, Bardis or whatever, and Dr. Ely have also been putting together protocols for what to do and getting the spike proteins and whatever. And they've done a lot of work on it, and a lot of people have worked on it. So I guess there's a lot of protocols out there, but frontline doctors, as Donna mentions, is a place to start. Any comments?
I am not familiar with them. I apologize. Okay.
Yeah, I mean, there was recently a summit on treatment of long COVID and any bad effects from any particular medical treatments. And they go into, I mean, it's very complicated with the spike protein and as many different things that can go on. I mean, I think, one component, well, I don't want to give medical advice, but there's many different components of it that have different treatments. And first you got to get the spike protein off of you, then you've got to neutralize it, and then you've got to get it out of the body. Anyways, there's been a lot of work on that, but maybe starting with the frontline COVID folks, Dr. Artis, Dr. Ely, they've been working on it quite a long time. I mean, it's very complicated and very interesting. So, any thoughts? Okay, psoriasis and gut health. Of course, any autoimmune disease. I don't know if psoriasis is autoimmune, but it certainly they start in the gut. So, comments on psoriasis?
Yeah, I did mention that I work with quite a few people with psoriasis. I looked at that multi-tiered approach that Dr. Montoya also was saying that, with very good results. I mean, people with whole body psoriasis after 1 year, 90% reduction in psoriasis using this multi-integrative approach of, the environment, the internal, what they're eating, the microbiome, the modulation of the diversity and specific strains for the skin of the microbiome.
Yes, I agree, Christine, that in psoriasis, it has been also characterized that there is a decrease of organisms like the Faecalybacterium prausnitzii and other good bacteria like Akkermansia, Lactospira, and they are creating this inflammatory milieu of gut dysbiosis. And the other component that is important is the integrity of the lining of the gut, of the barrier, because that is a checkpoint for toxins and pro-inflammatory molecules to go from the gut to the blood. So gut health is also about the right balance of bacteria, but also having a good integrity of your barrier that, as Christine mentioned, can be measured with zonulin, for example, zonulin levels for gut permeability. So in psoriasis, which is where the more superficial layer of the skin, the keratinocytes, go crazy. They are just producing uncontrolled keratinocytes, and that's why you see these skin lesions. It has been tied to the lower levels of bacteria that are known to decrease inflammation, and increased levels of bacteria that are known to increase inflammation.
There's a last question on dementia, which is multifactorial. I mean, you can look at some of Dale Bredeson's work, and he's looking at various components to prevent it, to reverse cognitive decline, but preventing it would be multifactorial. I mean, you obviously get metabolic health. You don't want to have too much sugar. I mean, Permuter mentioned a study that taking antacids will increase your risk 44% or something, but it's multifactorial. Healthy lifestyle, etc. Keep your mind busy. And any comments?
I've looked at this in terms of in the cultures, in the blue zones, Costa Rica, Japan, the book, The Blue Zones, I highly recommend. And all of those people, their diet is very large amount is actually diverse plant food, but also fermented. They eat a certain amount of fermented food, much higher than in our culture. So what I found is obviously their water is so clean, the air is clean, in the blue zones, you don't get the pollutants at that level, which disrupts it. But I think the biggest thing too was the diversity of prebiotic and fermented food and the lack of pesticide and exposure to chemicals was a big factor. Chemicals are a major factor in Parkinson's, Alzheimer's, and dementia, precursor exposure to chemicals.
Any comments for Candida?
Candida is such a frequent colonizer that is hard to pin down a role. I don't think it has been ruled out either, but it's hard if it's found what to do with it other than when it's found in clear excess. So obviously we go with treatment for that. But we have to look at like we do with the herpes viruses as well, not just find it doesn't mean that it's playing a role, but you have to look at it where the candida is being found and at what level.
Okay. If there are any more questions, jump because they're about to leave. If you want to save the chat, there's 3 buttons on the bottom of the chat dialogue on the right. You click those buttons and then you click the chat and save them. So if you want to save the chat. Anyway, unless there's any questions, I want to thank our 2 guests profusely because of the information you provided us and answering our questions. And it was great. We hope you come back.
Great. Thank you so much.
Anyone wants to plug, go for it.
Thank you, Susan, and thank you for the great questions. Great audience. Would love to come. Thank you.
Bye-bye.
Thank you.
Thank you. Talk to you soon.